The right to health is constitutionally guaranteed in terms of Section 76 of the Constitution of Zimbabwe, and it is also enshrined in other international and regional human rights instruments such as the African Charter on Human and People's Rights. Quality healthcare provision is dependent on effectively merging financial and human resources and providing health services in a timely fashion when needed throughout the country. Despite inheriting a robust post-colonial healthcare system, Zimbabwe has seen a staggering decline in the quality of healthcare across the board. This has been the result of poor economic performance, leading to a brain drain and the increase in corruption in all aspects of society, including the healthcare system. The economic crisis, political instability, and rampant corruption that has engulfed the country since early 2000 has led to a significant decline in the quality of healthcare in Zimbabwe. Corruption continues to be a well-documented cancer in Zimbabwean society, despite the existence and establishment of anti-corruption laws and institutions. The 2020 Corruption Perceptions Index, CPI, by Transparency International, places Zimbabwe at a score of 24 out of 100 with a ranking of 157 out of 180 countries. In the past year, there has been a surge of interest on the impact of corruption on the public healthcare sector, understandably so due to the outbreak of the novel coronavirus, COVID-19 pandemic in Zimbabwe and around the globe. For instance, 60% of the respondents in Zimbabwe who took part in the 2019 Global Corruption Barometer, GCB, noted that corruption had increased in the past 12 months, and 25% of the respondents stated that they had paid a bribe to access public services. Transparency International Zimbabwe conducted a study and published a report on corruption in the public health sector in Zimbabwe. This report was informed by health sector-related complaints received by Transparency International Zimbabwe's Advocacy Legal Advice Center. This video aims to unpack that report. This study adopted a two-pronged approach which measured institutional vulnerability by combining data on perceptions from key informants, health professionals, as well as service end users in the healthcare sector, citizens. Information was gathered from all provinces in Zimbabwe. 1,103 respondents responded to the questionnaire. 21 key informants were interviewed, and 3 focus group discussions were conducted with a total of 40 participants. The findings revealed a general lack of confidence in the public healthcare system in Zimbabwe. 75% of the respondents expressed lack of confidence in the public healthcare sector. This low level of confidence may help explain why privileged senior government officials opt to receive medical care outside of Zimbabwe. 81% of respondents agreed that they had experienced, witnessed, or heard of corruption occurring in the public health sector, and a further 5% preferred not to say whether or not they had encountered corruption. As a result of the low wages and poor working conditions, public health sector workers have resorted to moonlighting, absenteeism, illegal referrals, and even bribery. Out of 1,103, 601 respondents reported to have experienced or witnessed absenteeism when trying to access health services. 434 experienced favoritism. 345 were solicited for informal payments. 340 reported having unnecessary medical procedures, and 332 reported overcharging. Key informants stated that most of the corruption in public procurement largely occurs in the high echelons of power, and in most instances, reputable pharmaceutical companies are sometimes left out in the bidding processes, while briefcase companies with links to politically exposed persons are given preferential treatment. One of the procurement malpractices highlighted in the public healthcare sector is the COVID gate scandal. The scandal was first exposed by the media, who revealed that the government had entered into contracts with briefcase or shelf companies for the procurement of COVID-19 response equipment. At the center of this scandal was the former Minister of Health and Childcare, Obadiah Moyo, and what appears to be a shelf company, Drax International, LLC, with no physical location. Registered in February 2020 and having been in existence for only 2 weeks, it was awarded a $1 million contract by the Ministry of Health and Childcare to supply materials to fight the COVID-19 virus. The effects of public procurement corruption and the embezzlement of funds are evident in the serious shortage of essential medicines and equipment at major public health institutions. As noted by Transparency International Zimbabwe, over the years there has been a general rise in citizens resorting to bribery to access service delivery in Zimbabwe. 74% of the respondents indicated that they had been asked to pay a bribe while accessing healthcare services at public hospitals, with 91% of those having paid bribes ranging from $1 to $200. One respondent in Mutare noted,
"In most cases, if you do not bribe the healthcare workers on duty, it will take long for you to be attended. Sometimes health conditions of these patients will be serious and requiring urgent attention. When such things happen, you will be indirectly forced to give them a kickback for assistance."
The poor and the marginalized members of society who are unable to pay monetary bribes have not been spared, with 76 respondents stating that they have resorted to offering healthcare workers a bucket of maize or other foodstuffs as a bribe. 31 respondents indicated that they have offered various non-monetary gifts to healthcare workers, such as offering them a lift, facilitating healthcare workers' children's placements in school. Also, 4 respondents indicated that they had transacted in sex to get access to health. Findings are revealed that in most public hospitals, there are unnecessary delays and poor service delivery, which creates opportunities for extorting patients or clients. Since 1991, there has been a tremendous increase and growth of private healthcare centers, largely underpinned by an extensive private sector health insurance system. This has facilitated medical specialists and general practitioners to open private health facilities, whilst at the same time rendering their services in the public sector. Respondents raised concern over perceived false referrals by healthcare workers in the public sector so that clients would receive services in the private sector. I have seen a lot of medical practitioners referring patients to private doctors or labs for something that could be dealt with here. Medical practitioners are referring patients to a networked fellow practitioner for onward services in return for kickbacks. Lack of drugs and equipment in public hospitals, in large parts as a result of mismanagement of funds and procurement fraud, creates a notion that private hospitals or clinics have better services, leading to exorbitant charges in those private facilities. 32% of the respondents indicated that they had witnessed or have been asked to undergo unnecessary procedures. What has been visibly apparent is that the pandemic has not only amplified the effects of corruption on the health sector, but has also exposed corruption risks and vulnerabilities in the sector. Whilst corruption affects all sectors and has adverse effects on a country's political, economic, and social development, its impact on the health sector is dire and can lead to the difference between life and death. Findings from the report reveal the existence of corruption at all levels of the public health system in Zimbabwe. This paves way for poor service delivery, creates opportunities for counterfeit or inferior medicines, deprivation of basic human rights, and unnecessary death. Previous outbreaks of cholera, typhoid, and tuberculosis, and more recently, the COVID-19 pandemic, continue to highlight the importance of crafting anti-corruption measures that will strengthen health systems. Implementation of the following recommendations is necessary to fight corruption in the healthcare sector. There is need for multi-stakeholder partnership in advancing anti-corruption, transparency, and accountability in the health sector. The National Anti-Corruption Strategy 2020 to 2024 provides a platform for partnership and collaborations between the Zimbabwe Anti-Corruption Commission, the Office of the Auditor General, Parliamentary Portfolio Committee on Health and Childcare, the Ministry of Finance and Economic Development, and civil society organizations to work closely with the Ministry of Health in crafting strategies that will promote transparency and accountability. The Ministry of Health and Childcare and the Zimbabwe Anti-Corruption Commission should commission a comprehensive corruption assessment that analyzes the perceptions, experiences, risks, and vulnerabilities within the health sector. The government of Zimbabwe should commit to implementing the Abuja Declaration by allocating the set target of at least 15% of the annual budget to improve the health sector. Watchdog institutions such as civil society organizations and the media, with an interest of knowing the beneficial owners of companies awarded public tenders, should be allowed to access such information without the consent from the company or through a court order, under the Beneficial Ownership Clause of the Companies and Other Business Entities Act of 2019. There is need for the country to develop and adopt asset declaration and lifestyle audit laws that make it mandatory for senior public officials to declare their outside activities, employment, investments, assets, and substantial gifts or benefits from which conflict of interest may result. Strengthen internal systems for detecting corruption by establishing and adopting whistleblowing and complaints mechanisms such as toll-free numbers and anti-corruption desks at public health facilities. Education and training of healthcare workers on anti-corruption and ethics is necessary, as this will contribute to a better understanding of the harmful effects of corruption. The development of service or patients' charters for all public hospitals in local languages will help improve patients' knowledge and understanding of their rights. And finally, improve the compensation and terms of conditions for public healthcare workers through financial and non-financial incentives. Poor remuneration of healthcare workers coupled with high cost of living has led healthcare workers to solicit for or accept bribes to improve their standards of living. Zimbabwe is part of the countries that have committed to achieving universal health coverage and other sustainable development goals by 2030. However, corruption impedes achieving these goals. Therefore, there is an urgent need to address corruption risks and vulnerabilities in the health sector to achieve these goals and a thriving and equitable society for all. This report was published by Transparency International Zimbabwe with support from the Embassy of Sweden in Harare.